Now, Kenya's Chamas and SACCOs have long been the backbone of savings and investments for millions. But when illness strikes, most households still fall back on Harambes. Now, there's a growing push to integrate health insurance into these powerful financial institutions. Victor Wafula now reports.
According to the FSD Kenya survey, more than 80% of Kenyans belong to a Chama or a SACCO, yet fewer than 20% have medical insurance. That gap leaves many families exposed to medical shocks that can wipe out years of savings. Hospitalization costs are among the fastest rising expenses. A single admission can run into hundreds of thousands of shillings, pushing families to deplete savings, borrow, or even sell assets.
We are all one hospital bill away from poverty. Now, it could be not just yours, but that Chama member who you care about, that Chama member who you have a relationship when they are unwell, you're going to look for some way or the other to do it. Think about it. You're doing a project together. You're buying a piece of land together. If they're unwell, they're going to need to source some funds to take care of whatever illness is there. As they do their investments together, that the risks that could impact the very same investments they are making are addressed. And therefore, the first low-hanging fruit becomes health insurance. Every member of that Chama needs to have some form of health insurance so that then when something goes wrong, it doesn't disrupt their day-to-day abilities to make investments together.
Pooling resources changes the story. Industry data shows that if just 20 members contribute 1,000 shillings each monthly, they can unlock up to 1 million shillings in inpatient cover per member, along with outpatient and maternity benefits.
We now have a growing retail population who are now saying, I want an insurance cover and are able to purchase. But you'll find that group schemes tend to have certain advantages because it is a bigger group. And then, of course, you take care of the fact that there's a control factor. HR will be able to manage the issue of behavior even with the group and keep the costs at a level where it can afford.
Even partial uptake could transform healthcare financing, shielding households from medical bankruptcy and expanding industry penetration. Victor Wafula, NTV.